Okay, so in addition to that, there's one other key thing we're going to talk about as a symptom, and that's suicidal thoughts. Um, this is this is a serious enough symptom that we're going to spend some time looking at this. We know that about 30,000 people each year in the US die by suicide. And for every suicide that is successful, there are at least 8 to 25 attempts beforehand. So, given that it's really prevalent and is actually the second leading cause of death among US college students, which is not great, it's important that we take some time to talk about it and how to spot warning signs and things like that. So, there are many factors that might go into why someone might try to attempt suicide. But here are a few common ones. So, first, and kind of maybe most obvious, previous suicide attempts is one of the most common predictor of future suicide attempts. So, again, oftentimes many attempts occur before a suicide is successful. But in addition to that, there's also self injury. So, if someone is injuring themselves, maybe not fully taking their life, but in a way that is causing them harm, that is often a predictor. These kind of extreme depressive kind of behaviors, feeling really hopeless, feeling like you're a burden to others, feeling like others would do better if you were not around, and isolating yourself socially. If you notice that in your roommate, your friends, people around you, that is something you should take note of. Substance abuse, so often, um, you know, doing drugs or alcohol to an extent that it is over your limit, over your level where you can tolerate it. So abusing those types of substances, but also individuals who belong to a minority and a stigmatized group, which is also problematic. But anyone who feels like they're mistreated by society or in a way that just is not living a life of joy might also be a predictor as well. So here's what you should do. Here are things that you should remember. Suicide's a serious topic. A lot of people are hesitant to talk about it or unaware of how to approach it. So here are some things. First off, talking about suicide doesn't mean that the person you're talking to will consider it. You are not putting that thought in their head, I promise you. So don't hesitate to bring it up. Also, asking someone point blank directly if suicide is something that they're contemplating, again, doesn't make them consider it for the first time. Chances are they didn't need your help to do that. They just because someone is talking about suicide doesn't necessarily mean that they're going to do it. It might just be a cry for help. It might be a sign that they want to know people are going to care about them, or that they, hope people will kind of reach out and show their love and affection and show that they want that person around. You look for those warning signs. So if you see that kind of withdrawal, reckless behavior, someone who is giving away their prized possessions, so kind of making plans post death, those are kind of things to remember and keep in mind as well. But honestly, one of the most important things is to take the person seriously. So treat every sort of instance as something that might actually they follow through with, instead of oh, that's just Johnny jokes all the time. Be supportive, ask them point blank, offer them resources to get them help. um, it's hard, so never assume that they're just like looking for attention or being dramatic. You can never be 100% certain of someone's internal state, so there's no need to take that risk. So here's what some of the things you can offer. Again, and I've mentioned this a couple times in this lecture, but it bears repeating, there are free appointments for students at OSU through the Student Counseling Center, Counseling and Consultation Services, also the Psych Services Center in the Psych building. But also if you're still at home or in a different area of the world, there are resources around you, and I'm happy to help you find one if you need it. There's also a website, so this is through OSU, that has a list of suicide prevention resources that you can utilize for yourself or for a friend. And then also just in general, if there's an emergency situation, there's a suicide hotline, but also 911 is also your best friend. So these are things that I want you to take seriously, that I want you to know is really prevalent in college and prevalent specifically in major depressive disorder. So detour. So yeah, it's pretty common. prevalence-wise in the adult population, and it's highest in those college-age students. It's also more common in females than it is in males this time. So this is something that is definitely worth taking seriously. As far as causes go, again, biological causes, there's a 40% concordance rate in twins, so it might have some sort of genetic component, but again, not as strong as we've seen in others. Low serotonin levels. So if you remember back from the neuro chapter, the neurotransmitter serotonin is involved in a lot of kind of mood or sleep or appetite. So it would make sense that having lower levels of serotonin would lead to these kind of lower experiences and behaviors in those domains. You also might have an overactive cingulate cortex. For instance, the anterior cingulate, ACC, is often connected pretty heavily with the amygdala and does a lot of emotion regulation. So having a more active ACC might lead to some kind of abnormal emotion regulation patterns. And then lastly, disturbance of your circadian rhythm. So an internal kind of rhythm and different sleep patterns and things like that might kind of mess your body up from an underlying body perspective. But there are a lot of other causes here as well. So we're going to walk through a few more. One is an actual kind of learning classical conditioning cause. So if you have a reduction in positive reinforcement, if things that you initially were rewarded for doing now no longer reward you, it might make you start to feel less pleasure in doing that activity, feeling like that doesn't matter anymore, or you're not as effective or useful in that domain. And it creates this kind of learned helplessness. So if you've felt helpless before, it kind of perpetuates this cycle where you can condition yourself to just not be able, you're like, if I can't get out of bed or I can't do this thing, that's just who I am. I'm going to keep doing it in that way. And you kind of get stuck in this cycle. There's also some cognitive causes as well. So one of the key words here, maybe you've heard of rumination before. So when you ruminate on something, you're really focusing on that particular thing. You're focusing on the causes and consequences of your depression or of a particular situation that you have. And so you're unable to kind of get yourself out of it because that's all your mind can think about. And then lastly, it goes without saying, environmental extreme stress might also cause this. So we experienced some examples earlier in this lecture, for instance, experiencing a death in the family or experiencing some traumatic, your house catching on fire or doing something where it just throws a huge wrench into your life. That can often kind of lead you into a period of depression as well. So a bunch of causes that go into major depressive disorder. And I want to again, refer back to this diathesis stress model. So if you've got some underlying kind of predisposition, combined with something like stress, can often be enough to trigger the experience of major depressive disorder. Treatment-wise, medication is huge. So antidepressant medications, for instance, SSRIs. So if you see this abbreviation, it stands for selective serotonin reuptake inhibitors. There are a lot of words there, and there are words that I think you might kind of be able to piece together. So again, serotonin is that neurotransmitter that kind of deals with mood, appetite, sleep. Reuptake is something we talked about in the neuro lecture. So if you remember in a chemical communication, that's synapse. So when the presynaptic neuron is communicating with the postsynaptic neuron, remember how there's kind of that gap in between where the neurotransmitters float across. And then after they're kind of done doing their job, they tend to either like disintegrate or they get taken back up again through reuptake into the original cell. So this is inhibiting reuptake of serotonin. So what this is doing basically, so instead of serotonin being projected to the second cell and then kind of being like, cool, I did my job, I'm done, and being reuptaked in the original cell, it keeps it in the synapse longer. It refuses it being allowed to be reuptaked into that first cell. So because it's staying in that synapse longer, it's able to kind of keep stimulating that second neuron a lot more than it would have otherwise. So you don't really have to know all the details of that, but I think it's something to kind of cool and piece together the knowledge that you have. So antidepressants, SSRIs, are a common treatment of depression. but also psychological approaches are super useful as well. So in particular, cognitive behavioral therapy, we talked about CBT. So this is kind of learning how to both restructure your thoughts, your cognitive distortions, and being able to replace them with something more realistic, but also just using some behavioral therapy as well. So kind of either promoting positive behaviors and kind of reducing those behaviors that are more maladaptive. And then lastly, there's an environmental treatment as well. Maybe this is something you've experienced or could do. So this is exercise. Exercise can boost your mood so much. And this is especially helpful for someone with major depressive disorder if they're having trouble getting out of bed or having trouble really like going out and doing stuff. Making a point to kind of try to exercise your body and get your heart rate up is also a good way of treating and preventing depression. Okay, so again, I'm gonna show you another SciShow Psych video. This is from Hank Green this time, talking about the prevalence of depression and a combination of the different causes. So this is a good kind of review of what we just talked about.